If you are new to this channel, I am Dr. Himadri. Today we will be talking about a very important topic, that is rubella. Rubella, this is also called as German measles, and it is not a very dangerous disease if it happens in case of children or maybe young adults, usually in children's. Okay. But this rubella, if it happens in utero, that is in fetal life, this is very dangerous. So our topic of discussion is rubella and also CRS, that is congenital rubella syndrome, which is most dangerous. Okay, and this is commonly asked in your MBBS, in NEET PG, as well as in nursing students. So read it properly. So rubella is caused by a virus which is called as rubella virus. This is of toga viridae family. Okay, and this is also a RNA virus. You know that it can happen. Look here, it can happen in children in case of fetal life, as well as it can happen in adult. So three form of this infection which could be seen in different age group. So in case of children, the disease is usually mild. We call it German measles or maybe 3-day measles. You know that. That means measles-like symptoms, that is fever, coryza, and rash. This pattern is seen in case of rubella, but it persists for only 3 to 4 days. Therefore, we call it 3-day measles, and this is a mild disease in case of children. But in case of fetal life, there is congenital rubella syndrome. But in case of adult, it causes moderate to severe form of disease. So, a few words about if this happens in children. Suppose there is cough, so a child is having suppose rubella, or maybe adult is having rubella and there is cough. Because of this, the virus is aerosolized in the air. So what happens? Suppose a child comes here, automatically the respiratory epithelium is the target. Virus goes and enters your respiratory epithelium. There is multiplication, and I have already talked. There is your this beautiful policeman, which is actually your macrophage. Macrophage engulfs this virus, cannot process it, and goes to the nearest police station. This is your lymph node. Okay, within the lymph node there is multiplication of the virus, and after that there is secondary viremia into the bloodstream. That is, now the virus from the lymph node comes into your bloodstream. Okay, when the virus basically comes into your bloodstream, there is fever because of the entry of the virus into the blood. Okay, and as well as there is features like rash, and it usually starts from your face, and this is macular, and also the senti, and also what is this pattern? This is actually called your centrifugal pattern. Okay, that is from face to trunk and eventually goes to downward, and when it goes down, eventually the rashes of face basically goes away. Okay, and another thing, there is some red macular or some deep pink colored macular lesions which are seen in your oral cavity. These are called as Forchheimer spots. I don't know who gave this name, very dangerous name. So this is called as Forchheimer spot. So I told you in your previous lecture that a Koblik spot is pathognomonic for your measles, and here your Forchheimer spot, very dangerous name. Forchheimer spot is very classical, rather pathognomonic in case of your rubella. Okay, and some few complications that could be seen in children, that within onset, within 7 days of it, if so, it can cause some meningoencephalitis, only seen in immunocompromised children. So, within 7 days, the very dangerous complication is meningoencephalitis. In case of adult, it can cause arthritis. That also happens within 7 days. But after 14 days, another complication, thrombocytopenia, that is the reduced platelet count, could be seen in this patient. Okay, so that's all about rubella, and you need not to treat anything for this. If there is fever, you can give paracetamol, oral paracetamol, as well as oral hydration. That is all, no other treatment. Look here, this is typical rubella rash. This looks like measles, and this is the typical rash, red rash. Okay, no treatment required. Most important thing here is that your congenital rubella syndrome. What is congenital rubella syndrome? It is basically characterized by this triad. What is this triad? There is microcephaly, there is PDA, that is patent ductus arteriosus, and there is cataract, which is seen in eyes. Okay, so these three things is present. This basically makes the triad of congenital rubella syndrome. What is the pathogenesis? This rubella virus. So what is happening if during pregnancy a mother gets this rubella virus? Rubella will enter into the respiratory tract and it will eventually multiply within the respiratory epithelium, and also it goes into the alveoli, and you know that within the alveoli we have this policeman. Once again, this macrophage cannot destroy it properly, it will go to nearest police station. Okay, this is your lymph node. Within the lymph node this virus will multiply and eventually these virus particles will come into the blood after a lot of multiplication. This is called as secondary viremia. Now the virus is within the bloodstream of the mother, and this is mother's uterus. Look here, this virus is within the blood and it is jumping into the blood of the baby which is within the mother's womb. Okay, so what is happening, this virus actually within the baby's blood vessel, it causes some sorts of vasculitis, inflammation within the vessel wall, and eventually there is tissue necrosis. That means that is the blood supply to multiple organs will be compromised because of this. Okay, and this will persist, and another thing, because of reduced blood supply to multiple organs there are some organ defects which are seen, and this basically called as your congenital rubella syndrome. You know that some cataract and also PDA in the microcephaly. That means what is happening, brain is affected, your heart is affected, eye is affected, even liver and even kidney could be affected because of this virus. Okay, so what it is doing, it can and another thing, within the brain of the baby the virus basically accumulates, that is there is persistence of the virus within the brain. Okay, therefore there is chronicity, and also it causes DNA damage, DNA break within the cell, and therefore this is dangerous. Look here, what is happening, if the chances of CRS, that is your congenital rubella syndrome, if it is acquired earlier in the pregnancy, that is in the first trimester, when different organ systems are getting developed within the baby, the fetus will be affected more and it will cause dangerous complications, that is the CRS. Okay, and if the mother acquired this in the late phase, that is in the third trimester, usually it doesn't cause any problem. Okay, suppose within 11 weeks of pregnancy, if a mother gets this and baby gets this, there is 90% chance of having CRS. And within 11 to 12 weeks, that is weeks of pregnancy, the chance is 33%. 13 to 14 weeks, 11%. But unfortunately, in 15 to 16 weeks, it also the incidence also increases by 24%. But the general trend is earlier if a mother acquired this disease, more dangerous it is. Look here, 90%, 33, 11%, eventually getting down. And after 16 weeks, if a mother gets this, there is rare chance of having CRS. Usually it doesn't happen. Okay, so most important thing here is your clinical manifestation of CRS. You already know the triad. Okay, so look here, this is the baby which is actually having this congenital rubella syndrome. Most important thing, this viruses goes to the your cochlea. Okay, and here your organ of Coti is basically getting damaged and the nerve endings are basically getting damaged, therefore there is nerve deafness, baby cannot hear properly. Okay, and another thing, unilateral or bilateral congenital cataract. That means the virus is deposited in the lens and also causes this cataract. Okay, so this is unilateral bilateral congenital cataract. And number 3 is salt and pepper appearance of the retina. It basically affects the retinal blood vessel and causes the salt and pepper retinitis. Okay, and most important thing you should not forget is within the heart, it basically multiplies within this region in the PDA, that is patent ductus arteriosus. What happens, within this connection, this virus multiplies and causes tissue damage, and because of this there is persistent of ductus arteriosus. Okay, so blood flows via this. Look here, I'll zoom in, this is PDA. Okay, and another thing, look here, this is your right heart, Okay, it can causes right pulmonary artery stenosis. Look here, this is right pulmonary artery stenosis, or it can causes left pulmonary artery stenosis because of this virus multiplication. Another complication is low birth weight, and don't forget that it can cause in later life psychomotor delay, neurodevelopmental delay, and also neonatal purpura, which we actually called as blueberry muffin spot. Blueberry muffin spot, these spots because of neonatal purpura, which is basically termed as blue baby muffin spots. Okay, so never forget that, right? Do you have any treatment for this? Look, this treatment, we cannot cure this disease completely, but we do have multimodality approach. Like in case of cataract, you have to go for ophthalmologist, and also neurodevelopment outcome, pediatric neurologist or some pediatrician you have to uh, attend. So this is a multimodality approach, but the disease is dangerous as it is congenital. It will cause congenital, that means permanent problem. Okay, so that's all. Very very important topic asked in NEET PG, in MBBS, in nursing students. So read it properly. Thank you. We will see in next video, and don't forget to subscribe because more such videos are in the pipeline so that you can get all these videos. Thank you.